We've insured about 160,000 new people in the last 4 years, and if that healthcare budget is cut, a lot of people will lose health insurance and they'll become sick and they're going to crowd the emergency rooms, and some of them will actually die.
I didn't even know of these pre-existing conditions because I hadn't been, I felt healthy, I just felt tired and run down and cranky, but I thought that was because of my job.
There's many different reasons why people don't come in. They can't afford it, they don't want to be a burden. If they can't, they feel fine until they don't.
Because I am in business for myself, I couldn't afford to just go and buy health insurance because I'm never sure exactly what kind of a gig I'm going to get. So it was just, there wasn't enough money. So I thought, unless spurting blood is involved, I'm going to not bother with a doctor.
There's thousands of patients here who would be impacted if the Affordable Care Act is repealed. And that would be really a crisis in our community, because we've uncovered and unmasked many different chronic illnesses in these newly covered patients.
Shortly after moving to the East Bay, I had become involved in a study at UC San Francisco, and they told me, you need to see a doctor immediately. Your blood pressure is way too high. They were surprised I hadn't had a stroke. That's how high it was.
These are people who are contributing. They're working. They're our neighbors. We see them in our community, we interact with them.
I need to see somebody soon, and what am I going to do? So I'm trying to figure out how much money I can put aside and what kind of a job I can get to get the money really quick so I can pay to go see a doctor about this.
The Affordable Care Act was very important in bringing our clinics uninsured level down from, I think at that time, we were 35% uninsured. Right now, I think we are about 1% uninsured, 1 or 2% uninsured. So huge impact.
Then when Obamacare came along, it was incredible, the amount of doctors and the medications I could get and didn't have to pay out of pocket for because it was costing me a fortune. And when you're paying out of pocket and you have no health insurance, it's like sometimes you think, do I eat or do I pay for the medicine? And it really truly gets to that point.
One of my colleagues saw a brand new patient, a Burmese refugee patient who was 11 at the time. He couldn't walk, had never seen a doctor before, never seen a Western doctor before. No one knew what his medical condition was. He got his insurance, physical therapy, and now she just told us that he is now able to walk with a walker.
Quite frankly, I am terrified because without Obamacare, without what the ACA has put forth, I don't know where I'd be. I probably wouldn't be here because, like I said, they were surprised I hadn't had a stroke by now.
If it does go through a repeal, it's a public health crisis, quite frankly. Ending people's lives early, lots more suffering and chronic illnesses, worsening of preventable things, not screening for preventable things and catching it early and curing it.
No one should ever have to worry whether or not they have enough money to be well.